Okay. So yeah, my name's Matty. I work for Liverpool Sport and Recreation as a physical activity and sports development officer, and I've been working on the We Are Undefeatable campaign from a local level. Next slide, please. And next slide as well, please. Okay, so just a bit of background about our sort of overarching physical activity campaign called Fit for Me. So this is aimed to inspire local people to be active. So this is anyone and everyone that you can imagine. And it's a behaviour change campaign as well. So it's trying to really get into the mindset of individuals and make them aware of the positive impact that physical activity can have on their health and well-being. The main messaging, as you can see there, is sort of more for encouragement and motivation. The insight that we found was that this was more beneficial to individuals who were inactive or were not meeting the recommendations. So simple things like, have you thought about trying 10 minutes of activity, or have you thought about doing this activity? Don't worry if you haven't been active on this particular day. Those kinds of messages resonated more with the target audience, rather than actually telling people what to do. So do this, do that kind of thing. It's more encouragement and motivation. Next slide, please. So the purpose of the We're Undefeatable incorporated into the Fit for Me campaign was to use the national We're Undefeatable message locally through the Fit for Me campaign. So the Fit for Me campaign has already targeted a lot of people to be more active within the city, and the We're Undefeatable campaign was perfect to target sort of people with more extreme barriers, with health conditions and that kind of thing. So that was the main purpose of incorporating the message into the Fit for Me program. Next slide, please. So this slide is just a bit of background data. I won't go into it in too much depth, but there was about a third of the Liverpool population that are living with a health condition, and quite a large amount of the Liverpool population are also inactive. So as you can understand, it's not a very good combination, and there's probably a reason why there's a third of people living with a health condition if there's a large majority that are inactive. So this is a reason why we sort of went in the direction that we did. So you can see there's sort of 7 conditions there, and they were the more targeted conditions and the more prevalent conditions in the city that we concentrated on the most initially. Not to say that other conditions were sort of disregarded, but these were, like I said, these were the more prevalent ones that we wanted to cover. And yeah, it was really important to capture all these in sort of the insight, and then we were able to move forward with the actual program itself. Next slide, please. So this is just an example of obviously some of the barriers and the motivators to exercise. So yeah, the barriers are the usual barriers, but like I mentioned before, people with health conditions have even more barriers than, say, sort of an individual like me or you. So they have maybe fear of making the condition worse and that kind of thing. So it's about sort of really understanding that these barriers exist. So you've got the usual ones about time and cost and knowledge of activities, but having an awareness that there's an actual fear of taking part in certain individuals to be active who have got a condition. That's a barrier in itself to overcome, and then we can sort of concentrate on the other barriers. Motivators to being active as well is obviously why would a person with a health condition want to be active if they thought the activity would sort of be detrimental to their health. So it's kind of, again, understanding those motivators and barriers in tandem, and then being able to overcome the barriers, sort of explaining what the motivators are. So, for example, promoting the benefits of being active specifically per condition. So you could say, in the long term, you could bring your diabetes under better control, for example. But what are the short-term sort of goals around that as well? Next slide, please. So this is just an example of what we sort of wanted to learn from the actual campaign. So as I've mentioned, we had the existing Fit for Me campaign, but we really thought that the We're Undefeatable campaign would sort of complement it really well and sort of open up a whole new audience that we may not have been able to sort of interact with as much as we wanted to. So we basically wanted there to be more conversations about physical activity across the whole system. So you've got healthcare providers, physical activity providers, and just general community organisations as well. So we wanted the sort of conversation to be at the forefront of people's minds, not sort of after sort of X, Y, and Z. It's kind of the first thing that's talked about in terms of improving mental health and well-being. And of course, in the past sort of 12, 18 months, mental health and well-being's moving higher and higher up the agenda. We also wanted to challenge sort of the rest is best as well. Kind of notion that if you've got a health condition, in the past, you may have tended to be advised not to do anything at all or do very limited amount of exercise. Whereas we wanted to challenge that. And like I say, we speak to healthcare professionals, physical activity providers, community organisations to make them aware that any type of activity is beneficial to someone, especially someone with a health condition. Starting off low, progress slowly and build up gradually. So it's kind of the main thing that we wanted to learn. There's as you can see, there's a couple more bullet points, but we wanted to begin more conversations around the benefits of physical activity, particularly to those with health conditions. Next slide, please. So this is just a brief sort of activation approach that we were going to undertake. So we wanted to, like I say, we wanted to work with a range of organisations as healthcare providers, physical activity providers, and get the conversation started. Some may have already been taking place, but we wanted to sort of bring more organisations and partners together to develop these conversations. So as you can see, local engagement. We also wanted to produce some hard copy resources and online resources as well. I'll come on to that a bit later on, but we had to think more about the hard copy resources as a result of the dreaded COVID word. So it's kind of, it's helped us in a way. It's helped us think sort of outside the box in terms of what we were going to do initially as well. So it's brought up more opportunities and that kind of thing. And we've supported local providers in terms of developing their existing provision or maybe starting some new provision for people with specific long-term health conditions. So there's a couple of examples on there. So cancer rehab was with Everton in the community. There's a couple of housing associations we work with and a local tennis club as well. There are others. It's just to give you a flavour of what we've been doing. Next slide, please. So this is just, again, I mentioned about the Fit For Me campaign as a behaviour change campaign, and this is just the combi model. So it's an approach and a model that we've used in the past, of course, on Fit For Me, but on other campaigns that we've run in the city, and it's one that's worked as well. And it's just I won't go through it all, but it just gives you an idea of why we took the approach that we took. So, for example, social normative approach is Fit For Me campaign aims to build a social movement. So it's that kind of notion that if other people are doing it, then why can't I? Or I want to be part of that sort of movement kind of thing. So if other people are being active with a health condition, I want to do that, and I want to be part of that to improve my sort of health and well-being. There are other couple of things on there that we've covered as well. So incentives, motivational text that we've trialed out, and the opportunity as well. So as I mentioned, I've worked with healthcare providers and physical activity providers and tried to bring them together to promote different opportunities that are already existing in the city, but also sort of developing new ones as well, and encouraging the idea that it's any type of activity for any individual really, but particularly people with a health condition, is beneficial for you. So the message of just 10 minutes a day helps you feel good, or that kind of thing, it really does help improve your mental health and well-being. Next slide, please. So this is just an example. There are some later on in the presentation as well, an example of some of the hard copy resources. So we produced sort of some posters of local people, and ambassadors to share their stories about their physical activity journey and how it helped them with their health condition. We also produced little Z cards with specific information about the health conditions that I mentioned at the start, of the 7 health conditions. And we also produced an active at home booklet. So we used the Sport England active at home booklet and sort of developed it and tailored it to fit in with the local Fit for Me campaign, if you like, which was really helpful. We took some information from that, the Move and Medicine as well. Those kind of resources really did help us, and they do resonate with sort of the local community and that kind of thing. Next slide, please. So this is just an idea of one thing that we did with the campaign. So it's multifaceted. So to actually reach the people that we want to reach, particularly those with health conditions, you need to take a number of different approaches. One of them was sort of promotion through local radio or the local media. So the posters that were on the previous slides were shared through that. Social media as well. We had little sort of video clips, little sound bites on the local radio stations. So if people are driving to work and that kind of thing, they'd be able to hear it in the car. Hopefully they won't drive to work, but maybe they were cycling or walking. But that kind of idea that we're getting the message out through different sort of resources and different angles to target different people in different places across the city. And the main point is how do you make physical activity become sustainable for someone who may not have been active for 20, 30, 40 years. It's about changing their behavior, changing that mindset. So it's starting small and then building up. So for example, if you've got a local radio advert, it's just 30 seconds of someone speaking about the benefits of activity. That might resonate with someone in the car, and then they might start thinking more about physical activity, and that's just their starting point. So then they might think about where to find an activity, where to take part, how much they should be doing, that kind of thing. So it's a long process, but if you target it in the first instance with small steps, you can gradually build it up. Next slide, please. So as mentioned, we wanted a local voice, and the We Are Undefeatable campaign has got some really good sort of national ambassadors. So you may have seen them on the adverts, on social media, that kind of thing. I'm glad to say there's a couple of Scousers on there as well, which always helps. So there's a footballer on there, a couple of footballers, I think. But we've worked with them locally as well, which is really good to see them on the national campaign. The Fit for Me campaign, so the initial physical activity campaign, we recruited quite a few ambassadors to be that local voice. So again, if you've got a local person talking about their experiences, it's going to resonate more and sort of encourage people from a similar situation, similar background to be active. So if you just go to the next slide, please. So this is just an idea of some of the ambassadors that we had. And as you can see, the wide range and varied. So you've got families, women, men. There's a lady with a pram. You've got couples as well, different activities on there as well. So you've got running, swimming, that kind of thing. So we tried to target as many different activities and different demographics and backgrounds as we could. So we ensured that we could hit each individual across the city, essentially. So hopefully on there, and people on this call would be able to resonate with someone on that sort of slide. So for myself, I could resonate with the footballer or the runner. So it's just that kind of thing, that there's an activity for everyone out there. It's just trying to find the right fit for yourself. Next slide, please. So as part of the We're Undefeatable campaign, so the Fit for Me, We're Undefeatable, we also recruited 3 new ambassadors, Andy, Ron and Naheed, all sharing their stories about being active, but how it benefited their health condition as well. Andy's one, we won't show today, but Andy's is, for example, he has diabetes, and he was able to come off the medication that he'd been prescribed due to being more active and taking care of his sort of nutrition. So it's that kind of real. It's a local person telling their story about you can be active and it can improve your health condition. Now we're going to try and share the video if we can. Let's see.
I think being active just makes me feel happy. I feel that stimulation in my brain, and physically I just feel much better, more refreshed. Hi, my name's Nahid. I'm 53 and I'm from Mossley Hill in Liverpool. I was diagnosed with PTSD, post-traumatic stress disorder, in 2017. And I found being physically active really helps with my mental well-being. Since I've had the diagnosis, I've come to realise that my mental health is directly linked with my physical health. To keep active, I do a number of things. Before lockdown, I used to play netball. So what I do is I just gather the kids in the garden and we pass the ball to each other so I can keep that practice going. I go out for walks with my husband. I do something that's called chair yoga. For me, that gives me a bit of me time. It's that time just to myself that I take out, in the day and just, be at peace with myself. I notice that it is helping my mental health, and that's the inspiration that keeps me going. As a mum and a carer, I am busy. It's literally 24/7, I'm on the go. But I have to make that time out for myself, and it isn't difficult, and the kids understand because
Right, I think we'll if you want to get back to the main slides, I think you get the gist. It's a really sort of inspirational story, and
they see the benefits of the day when you're more relaxed, and I feel much happier because I want to.
Yeah, so it's just a really inspirational story, and of course as you can probably hear from it, the video itself was produced during lockdown or a period of lockdown. So it shows that Nahid was doing things at home with her family and that kind of thing. So because she wasn't able to go to her existing sessions, she was able to adapt to do things at home. And it's that kind of message with the ambassadors and the videos that we produced, that you can do something wherever you are, in whatever time you can, essentially, because Nahid is a real asset for us. She does a lot of community work, she does physical activity sessions, and she's the ideal ambassador, along with Ron and Andy and all the rest, because they all sort of actively look to promote physical activity in the local area. And as I mentioned before, it's having that local voice to be able to do this. And it resonates with other people in the local area to say, oh, if Nahid can do it, then so can I. If Nahid can fit time in around a busy schedule, then so can I. So it's that kind of idea, and that's why the ambassadors are a really integral part to the Fit For Me, We're Undefeatable campaign. If you just go to the next slide, please. So we won't look at the video, but there's just another example of Ron's video as well. Again, he's got COPD, and during normal times he plays bowls, he does home-based activities and that kind of thing, and it really does benefit his sort of breathing with the condition. If he didn't do anything at all, he said his breathing would get worse, and being active is one of the best things you can do for yourself. So that's a quote from Ron. So it's just, again, truly inspirational to hear like people from the local area that they're active and they're motivated to do it as well. And like I said, the thing that inspires me the most is their ability to motivate others as well. It's just really good to see. Next slide, please. This, I mean, I don't know how well you can see this picture, but this is just an example of the part of the website as well. So we've got a Fit For Me website, so fitforme.info, and it's got a lot of information about physical activity, benefits, all the rest of it, and different activities. And for the We're Undefeatable campaign, I sort of developed a section around health conditions and providing information about specific conditions, and also what activities are appropriate for a health condition. So as I've been working with physical activity providers, I've been able to have conversations about what appropriate sessions look like, raising their confidence, but also increasing the confidence of people who are referring or signposting to the session to know that they're appropriate sessions for people with a health condition. So that's just to give you a flavour of the website and how we adapted it. So so you've got the right activities for you. And during lockdown, there was being active during lockdown. So there was a lot of like home-based activities, gardening, that kind of thing. Because if we remember way back when we had some good weather, it was good to get people out and about in the gardens and that kind of thing. Next slide, please. So again, a busy slide, but I won't go through it. A lot of numbers. But the main idea is we have reached a large amount of people with our social media campaign. So we've had two. We're in the midst of the second one now, which is due to end at the end of this month. And it's sort of really engaged with a lot of people across the city. And this could be potentially people that have access to social media and online, so internet and that kind of thing. And that's what I mentioned before, about having sort of multifaceted ways to engage with people. So this is like the online section, and then we've got the hard copy resource section as well. And as you can see, there's been numerous amount of clicks, impressions, and page views and that kind of thing. And it's been really good to have it in the sort of local newspaper as well. And that's really helped engage with the audience. And it gets people talking as well. So if people are sharing and liking on Facebook and Twitter, not really up to date with Instagram, but if they're sharing things on Instagram, then it really does help sort of increase the conversations that people are having about physical activity. Next slide, please. Again, this is just a quick list of some of the key things that we've done across the past sort of 12, 18 months. I did mention briefly about the stakeholder group at the start. So about having conversations between different groups of people. So you've got healthcare professionals, physical activity providers, and community groups as well. And it's about getting them to engage with each other and sort of learn from each other about, from a healthcare point of view, when's appropriate to signpost someone, and from a physical activity point of view, are they confident enough to sort of deliver to someone with a health condition? And it's been my role to try and do that. And it's going to be an ongoing role as well as part of the legacy of the We're Undefeatable campaign. So the fact that they're having these conversations, there's about 60 plus people within this stakeholder group. We have regular group meetings where about 30 people attend each time. So it's really good to see that so many people are engaged with the campaign itself across the city. I've mentioned the website development. We trialed a motivational text service as well. So again, sort of kind of nudging people to be active using the Fit For Me messaging. So kind of, have you thought about being active today? Why not try this activity? I can put my phone number on there. People can get in touch with me directly to speak about physical activity. And hopefully from that, we're going to be able to roll it out to sort of GP surgeries and work more closely with them in terms of motivating patients to be more active outside of doctor's appointments and that kind of thing. I've mentioned the ambassador recruitment and also the hard copy resource as well. So it's just important to emphasize that we did look at numerous different approaches. So you've got the online website, you've got the social media content, you've got the ambassador recruitment, and also the hard copy resources. So this is for particularly people that were shielding maybe last year as well. We got sort of hard copy resources out to them. And we worked with organisations as well to sort of distribute this as well. So I think there was about 50 plus organisations that requested resources from us. So as you can imagine, their reach is going to be really great, and it's getting the word out about the benefits of physical activity and also the campaign itself. So making people aware of the We're Undefeatable campaign and sort of the benefits of it. Next slide, please. So these are just a couple of things that we want to sort of improve on, or we wanted to do, but maybe we're limited in what we could do. I don't want to use it as an excuse, so I just used the C word, but some of the stuff that we wanted to do was limited because of this. So you saw you saw one of the videos, and I've mentioned a couple of the others. We would have liked there to be more ambassadors, but due to social distance and that kind of thing, and the people that we're targeting were shielding the majority of them, so it's hard to sort of get them to interact with that aspect of the campaign. But I think it's something that I would want to sort of look at moving forward as well, to get more people engaged from a health perspective as well. Sort of gaining sort of buy-in from the communications colleagues. So again, more to sort of increase the word about the campaign and making people aware of the benefits of being active with a health condition. You don't have to be fearful and that kind of thing. Utilising local leisure centres, again, it was difficult because majority of them were closed for quite a large period of time. But again, moving forward, this is something that we're going to look to do. And that's another key thing to remember as well. Although the campaign officially may be ending, we are going to continue sort of delivering aspects of this campaign, and we've got numerous other ideas, which I think is leading me on to the next slide. Just go, yeah. So these are a few of our future plans as well. So again, there's a lot of work that's been put into this campaign up to this point, and I don't want to see it stop, and I don't want to sort of lose the momentum of it. So there's a lot of ideas. I won't go through them all, but I've mentioned about engaging with the GPs a little bit more about sort of the motivational texts. There's a Zoom community that I wanted to try. So it's similar to the We're Undefeatable community that was set up, that we wanted to try locally. I want to maybe widen the ambassadors and the role of them to become sort of peer supporters. And I mentioned that he sort of delivers activity sessions. We'd like more ambassadors to be able to do that, because how amazing is that to see an ambassador who's gone through and has a lived experience, and then they're now delivering, say, a cycling session or a walking session, and then they can encourage people in a similar situation to do the same thing. And I personally also want to work with the voluntary sector a little bit more closely as well, get them more involved and more engaged in it, and the campaign overall as well. So as you can see, there's a lot of things that I still want to do with the campaign, and following our evaluation, that will help us sort of direct things a little bit more clearly as well. Next slide, please. This last slide is just some recommendation that I would have if any other sort of authorities or areas were looking to sort of do this type of work. The key one being just starting to have conversations about physical activity and the benefits of it, but trying to engage different organisations within these conversations. So, like I said, through the presentation, you've got the healthcare professionals and the physical activity providers. So the physical activity providers obviously bring their expertise and vice versa. So starting to have these sort of really important initial conversations and getting people to think more closely about the benefits of physical activity to their service users, their patients, is a real good starting point. And the second one is the local voice as well. So I've discussed the ambassadors and how inspirational they are, and it is when you work in this sort of area of work, it is truly inspirational to see, like I say, the stories they've got, that they share, where they've come from and where they are now. And I'd like to think if it's inspiring me, then it's going to sort of resonate with someone with a health condition, or someone who's inactive, who wants to get more active and doesn't know how to. So it's that kind of idea, that encouraging more conversations and having a key local voice as well. They would be my two sort of key recommendations. And I think that's it. Next slide. Any questions?
Thank you so much, Matty. It's great to hear about all of the momentum that there is around the different activities that you've done. There was interest in the chat to access the videos, so we've shared links to those there, and I believe Nikki's also shared a link to some additional resources that are available. One of the questions that came in was around the motivational text, and if you can share a bit more about that in terms of the response you see to that kind of thing.
Yeah, so we did a pilot with Liverpool Heart and Chest Hospital with the pulmonary rehab team. So the idea behind it was people who have come through the program, once they've completed the program, we wanted them to then continue being active. And what the feedback that we had, the majority of the time they weren't, or they'd be given home-based activities and then they wouldn't sort of complete them. So we got sort of a cohort of 20 people, and the idea is sort of sending 2 to 3 messages a week to try and motivate and nudge individuals to be active, fitting in with sort of tying in with the Fit For Me messaging as well. So it's kind of more motivational encouragement rather than telling people what to do. Feedback we had was really positive. So it did continue with people being active. People were just doing the home-based activities, which was a real plus point, but also people were engaging with myself and they were asking questions about what other activities can I do. So it's kind of every person's different and everyone's sort of capabilities are different. So if someone's happy doing home-based activities, that's great. But then you may get people that want to engage with a community group, or they want to go for a walk in the park, that kind of thing. So we put on my contact details and they were able to engage with me that way, and we were able to sort of signpost and direct. So it's been really positive. And as mentioned, I would like to sort of roll it out to maybe other community groups, but also GP surgeries. So there's ongoing discussions about that at the moment. Because I think it'll be really beneficial for patients who maybe want to take that first step to be active to improve their health condition, but not really sure how to do it. And of course, GP's time is really sort of constrained, isn't it? I think it's like 5 to 10 minutes appointment. So anything I can do to help the GPs as well is a real positive.
Right, and just a question around, if I can ask around translation of hard copy resources, is that something that you would typically do, or is it something that you identified as a particular need for this campaign because of the target population?
Me personally, it was a new one for me with this campaign, but it was obviously the target population was far and wide, so it's something that we really did focus on, especially with the hard copy stuff. So there's been translations into, I think there's 5 or 6 different languages. Mm-hmm. But previous campaigns, I know they did do something similar. Sarah, my colleague from public health, she works on a number of different sort of public health campaigns, and I understand that she does do a lot of translated copies as well. So yeah, it's been really helpful in that regard as well, because again, we've been able to reach more people, and more people have been able to engage with the program, and it's developed more conversations as well with different organisations that I may not have sort of engaged with initially as well.
Yeah, makes sense. And a question has just popped up: how are you measuring the impact of the campaign?
So the evaluation is ongoing. So we are using sort of the social media analytics to see sort of how many people have engaged on that side of things. And also we're engaging with the Stakeholder Group as well. So I'm going to be meeting with them to see how it's how it's sort of benefited their service users. Have their service users been more active as a result of the information that they provided and that kind of thing. So that's a real positive measure of it, really, to see how they've engaged with the campaign from that side of things. Yeah. And you've obviously got sort of like the website clicks and that kind of thing. We're able to see how many people have clicked on specific pages, and so there's a number of different ways that we're sort of going to measure things, and it'll be quite interesting once the evaluation is complete to see the results.
Yes, I know it is important to note, isn't it, with you guys, that the evaluation is ongoing, and it's going to be completed early next year, I think. So I'm sure there'll be more to share at that point. One of the things I was wondering about was something that was quite interesting about Liverpool, was your integration of We Are Undefeatable with your existing Fit for Me campaign. And I just wondered if you could talk a bit more around the sort of the co-branding approach you took there, and why you felt it was important to sort of bring those two things together.
I think personally, it's the Fit for Me brand was already there, and it was already a trusted brand as well in terms of physical activity. So there's already a number of people that would have engaged with the Fit for Me program, engaged with different activities as a result of that. And as I mentioned earlier, it was the We're Undefeatable campaign was perfect for another sort of specific target audience that may not have been targeted as much as the initial, if that makes any sense. So it's kind of being able to work more closely with that target audience and break down their barriers. So like I said, about being fearful of damaging and making the conditions worse and that kind of thing. So that's the kind of the angle that it came from. So we were able to sort of specifically target the health condition audience, because we've already worked with sort of GP surgeries. We've done like GP awareness training and that kind of thing with regard to physical activity. So it's just trying to sort of marry the two up really, and that kind of aspect of it.
Yeah, so I suppose if you already had that in with some of your partners, so it made a lot of sense to sort of tally it together and link the two things. And then final question for me was, what are you most proud of in terms of, you've worked on so many different parts of different activities, what are you most proud of in terms of what's been achieved?
I think I'm most proud of the conversations that have been going on as a result of the campaign. So I've mentioned the Stakeholder Group, so the We Are Undefeatable Stakeholder Group, and again, there's 60 plus people on this group, and they're all sort of engaging with the program itself and the notion that you can be active with a health condition. It doesn't matter the type of activity, how long you do it for, that kind of thing. And it's the fact that, again, word of mouth, people engage with other organisations, and then they can get them sort of be on board. And from a health angle as well, all the health professionals have been really supportive of it. So we work with the local CCG, sort of GPs, nurses, physios, that kind of thing. So they're starting to sort of really emphasise the importance of physical activity to their partners, their patients, that kind of thing. So yeah, I'm just sort of proud to see that work developing. And as I mentioned, it's going to be an ongoing thing. So it's going to be regular meetings and regular catch-ups, hopefully some face-to-face ones in the future.
Nice, wouldn't it?
Yeah, not being able to do a face-to-face yet, but yeah, so it's kind of it's raising the awareness of physical activity across the city and across all the other sort of authorities and locations that have been working on We Are Undefeatable as well. I'm sure they're the same. It's raising the awareness that physical activity does have a positive benefit on your health and well-being, particularly if you've got a health condition, no matter how much you do. And I'd just like to say that, I'm sure a couple of stakeholders are on the call today. I'm just give my thanks to them to really engage in it, and without them, the work wouldn't have been possible as well.
Perfect. Well, what a great way to end. Thank you so much, Matty. It's been a great presentation. Thanks to everybody for joining as well. Hope you've enjoyed it. I've certainly found it really informative. If you do have any further questions, feel free to send them my way and I'll filter them in the correct way. So barbara@insightangels.com. And I hope as well you'll join some further sessions over the rest of today and tomorrow. You can find links to all of those in the invite for this session. But any problems, obviously, just feel free to contact me. But we'll close there for now. Thank you so much, everyone. Thanks, Matty.
Thanks.